Welcome back to This is Healthcare in America. I'm Reid Zeising, founder and CEO of Cherokee Legal Holdings. Today I want to cover where it all went wrong and alternative options. In the first episode of this series, we covered the fallacy of tort reform, wasteful administrative costs in the healthcare system, and pricing transparency, or lack thereof. Today, I'd like to talk about the healthcare system in the US in general, and how our healthcare system compares to those in other countries. We're a free market. We're a relatively laissez-faire government. We have a capitalist system that rewards those able to navigate competitive landscapes. And we have world-class medical research, leading to innovations beyond imagination. Yet, in 2018, the US spent 17% of our gross domestic product on healthcare, nearly twice as much as the average OECD country. The second highest ranking country, Switzerland, spent 12%. Compared to peer nations, the US has amongst the highest number of hospitalizations from preventable causes and the highest rate of avoidable deaths. The US spends more on healthcare as its share of the economy, nearly twice as much as the average OECD country, yet has the lowest life expectancy and the highest suicide rates amongst the 11 most advanced nations. The US has the highest chronic disease burden and an obesity rate that's 2 times higher than the OECD average. Is it access to care? Is it the cost of care? Is it the structure of our healthcare and insurance industry in our country? Or is it yes to all? Yet, we should work to reform our own system. Don't fall for the Canada or UK commentary that healthcare is available for all. It's somewhat true in many regards, yet wait times are long, options are limited, and it leads to a private and public marketplace for care where the haves receive high-quality, timely care, and the have-nots are left waiting. So let's start with some low-hanging fruit. Reducing administrative costs. We spend more than 1/3 of our healthcare dollars on overhead and administrative billing, advertising, profits and bonuses for healthcare executives. Administrative costs in countries such as Canada are half as much as the US. A PricewaterhouseCoopers study reported that our complex, fragmented healthcare system delivery wastes $210 billion a year on unnecessary billing and administrative costs. Focus on preventative care. We need to change our focus from disease management to prevention and health promotion. To change our focus to prevention, we need more primary care physicians, family physicians, and general internists. Multiple studies have shown that generalists practice more cost-effective medicine than specialists, and their patients have better health outcomes. Due to poor planning, we currently have an overall shortage of physicians in the US. The number of medical students recently has increased, but we have an even greater problem. The number of US MD graduates choosing primary care careers keeps dropping. Only 7% of graduates choose family practice. 19% choose internal medicine, but only a minority of those choosing internal medicine will become general internists. The majority will become subspecialists. Only 2% of US senior MD students plan to have a career in general internal medicine. And one reason is the cost of medical school. Student debt. The average total student debt amongst medical student graduates is $250,000 each. That is $4.3 billion in total educational debt owed by medical student graduates each year. Medical school costs are out of control. And while I'm not going to take on tuition inflation today, one reason medical students enter specialties is the average educational debt is so high. It influences many graduates to enter specialties that pay on average twice as much as primary care, so they can pay off their educational debt and see the rewards of their work. To influence more physicians to choose primary care, we could subsidize or forgive part or all of their educational debt if they chose and remained in primary care. In addition, they could receive an annual stipend for each Medicare patient for whom they coordinate care and provide medical homes. These stipends, added to their fee-for-service income, should provide an income comparable to the average specialist. This would be an excellent investment for Medicare. If each primary care physician can avoid unnecessary hospitalization, Medicare will come out far ahead. To be effective in prevention, primary care physicians must have certain skills, and our current medical school curriculums don't offer them. We offer minimal training in nutrition, prescribed exercise, stress reduction techniques, and other effective therapies for certain conditions. For example, acupuncture for specific chronic pain issues. We also can eliminate unnecessary tests and procedures, in addition to training a new cadre of adult generalists. With expertise in prevention, we must also ensure that physicians practice cost-effective medicine. At the present time, physicians vary tremendously in their use of expensive diagnostic tests and treatments. The average cost of treating a Medicare patient in some parts of the country is twice as expensive as in others. The most expensive cities have more hospitalizations and physician visits, and their physicians order more expensive diagnostic tests and procedures. There has yet to be evidence that more expensive treatment benefits patients. Much of the excessive treatment and unnecessary testing occurs at the end of life. We must encourage all citizens to have living wills to avoid unwanted procedures at the end of life. In addition, we need to increase research funding for projects that will help determine which diagnostic tests and procedures actually benefit specific patients. This research will increase the number of evidence-based practice guidelines. This isn't rationing, it's common sense. How about controlling the cost of prescription drugs? Our government must control the prices of prescription drugs, as is done in nearly every other nation. Drug companies can charge whatever they wish in the US. Citizens for other nations pay 20 to 40% less for the same prescription drugs from the same companies that we're buying from. Millions of Americans have chronic conditions that require lifelong medications. If their insurance doesn't pay for them, or they fall into Medicare's donut hole and can't afford prescribed medications, many patients stop taking them. The result is increased emergency room visits and hospitalizations, thus increasing our healthcare system's costs. Some authorities have suggested if we decrease the profits of the drug companies, they will stop researching and developing new drugs. Given that drug companies spend more than twice as much on marketing and advertising as they do for research, it's a very unlikely outcome. In summary, we must reduce the cost of our healthcare in the US. We can do this by developing a healthcare system that emphasizes prevention rather than disease management. To do this, we must encourage more physicians to be adult generalists, and we must provide them with new skills. Furthermore, we must ensure that all physicians have cost-effective practice patterns and that all citizens adopt living wills. As a nation, we need to have better control over the cost of prescription drugs. If we combine these things with insurance companies eliminating their administrative waste and hospitals being used for emergencies and not runny noses, we would see a significant decrease in premiums needed to be paid for the same level of care. That's about all we have time for in this episode. Thanks for watching, and tune in for the next installment of This is Healthcare in America. Have a great day and stay out of the hospital.